Hi, this is Dr. Carl Hansen. Today's video is going to be about a letter of concern I got. As you know, many of you know that I have been vocal, speaking out against a lot of the policies related to COVID, and our professional boards, and mine being a family medicine physician, I am certified by the American Board of Family Medicine. Certification means that when I finished my residency program, that I then took a test making sure that I knew what I was doing. And I passed the test, trust me. And you take the test periodically, but then you do your own education throughout the years. You never, medicine is never sitting back on what you learned in residency. It's everything that you've learned over the past couple months. So that's what the American Board of Family Medicine does. And well, let me just show you what the board is. So the American Board of Family Medicine, you can see it here, the logo at the header at the top. They are the certifying body which follows me, and they have about a year and a half ago, or maybe longer, sent out a letter stating that they are now going to be professional police, and they're going to start seeing what doctors out there who are certified are spreading misinformation and disinformation about the COVID policies. And many of y'all know since March of 2020, I've been vocal and doing YouTubes on this. So again, what they do is American Board, they certify you, they certify you, recertify you, continued certification, and then there's added qualifications that they can add to this. But what they also do now is you can see that they're advocating, as you can tell here. And the other items that they do is they explore disparities. That's another thing that they like to do. Then lastly, here's just an example, and this changes all the time. They're addressing food insecurities. I suppose all these certainly could be issues, but the job is to certify the physician that comes out of training to make sure that that physician has been trained up to speed. So there is no need for the American Board of Family Medicine beyond that. Because our own state licensing boards dictate how much certification we need. But as a physician, you kind of have to do that anyway because you need to keep up. Very little of what I apply in medicine has to do with what I learned in residency in the 80s. It has to do what I've learned over the past couple months. So anyway, let's get to the letter because I think the letter's interesting. So here is the letter. This is from the American Board of Family Medicine. I received this in September. It is a letter of concern. All right, that means that I'm not sure what it means, but why did I get this? What is the actual problem that I did? Well, here's their claim. Here's the claim that I denigrated COVID-19 vaccination publicly through social media platforms, and that they're currently reviewing the matter under the ABFM guidelines for professionalism, etc. But let's look at some of the details here of what I did wrong. And there's one other thing I want to bring up. Maybe I'll bring it here. So they cite videos from 2021, and I'll go into that a little bit. But I just like to point this out. My YouTube channel here, if you look at this, back in February 2020, I was doing, my last video was on personal injury claims. So you can see what happened in March, in March of 2020. I started doing coronavirus videos, and I was a bit perturbed by what was going on. Then you can see in March 13th of 2020, I posted a video on Wuhan hysteria. And this just kept going. And I did videos, and there's in April of 2020, I said virus policy must be modified. It just kind of went into a lot of issues that I felt were incorrect from the narrative. In June of 2020, returned to church, etc. And of course, I later talked about hydroxychloroquine and ivermectin. YouTube took down a few videos. I got in YouTube jail for a little while for not complying with CDC and World Health. We've all been there. The ones who actually stood up and said anything, we've all been there. Anyway, the curious part is I've been doing videos since March of 2020, and I'm only being cited for stuff in 2021. A lot of these older videos I actually took down and made them private because they were stale. They were just old videos, and I just don't like to have the channel completely cluttered. So maybe that's why they didn't pick up on it. I don't know. Anyway, so back to our task at hand. Let's go over all the mean things that I did. So one of my videos, they claim that that I said that this is technically not a vaccine, that it's a gene injection. So you notice they didn't, when they cite a video, this one from Rumble, they don't say what's incorrect with it. They just cite it, and then they want me to explain it away. I sent them a letter back saying, homie, don't play that game, that you first have to tell me what I said is factually incorrect. So anyway, there's nobody who can debate this. This is a gene injection, but that's denigrating in their opinion, the great denigrator. Let's do another one. I'm not going to go through all these, that I call it an experimental injection. I think most people consider it experimental. The mRNA technology used as a vaccine in humans is experimental. Again, they don't cite how that's incorrect. They just throw up stuff there. And yes, somebody actually went through my videos and transcribed them. I'm honored. And I put the early Pfizer data show the vaccine has no change in all-cause mortality. That is not. That's denigrating, I suppose, as it should be, but that's correct information. A lot of the Pfizer data was hidden. And which blows me away, this is the American Board of Family Medicine, who's supposed to be on the side of physicians, and instead they're just trying to crucify whoever they can find. I put there's no data on the safety profile. Well, at the time, when the vaccines came out, there was not significant data on the safety profile. Well, now there is. The VAERS database is showing just total spikes and adverse reactions and all that. So anybody in medical world who ever claimed that the vaccine was safe was just making it up. It was just making it up. There was no data enough to claim that anything was safe. So then they claim that I said that it could help, the vaccines can actually help breed the Delta variant. That's not just my position. That's kind of basic immunology. Anyway, so you can see they cite a big bunch of text here, but it actually is true that vaccinating with this type of shot actually can select for different mutants and mutations. So I'll keep going a little bit here. I put safety data has not been properly accumulated. At least I said that on a video. Well, that was true. The shot was studied for 3.5 months and then released on the public like a plague. It is a plague. So there's nothing incorrect about that statement, and nor is it denigrating. Keep going. I said the Department of Health is that's promoting the experimental jab combined with denial of early treatment causes more serious health issues. I still stand by that our governor and our Department of Health messed up totally and were really bad as far as medical advice. Another video is I say hydroxychloroquine, ivermectin works, remdesivir is bad, the jab is not safe and has not helped. Fauci and Gates are public enemies. Now, maybe that's denigration in there, but it's not factually incorrect. As a matter of fact, I say it's spot on. And it just keeps going. I put, we know that natural immunity is better than the shot. And they're actually saying that's denigration. They're implying that's incorrect information, that natural immunity, that the shot is actually better than natural immunity. Now, this is a board composed of physicians, and I don't even know who's on the American Board of Family Medicine, that actually states this. And they never did tell me what idiot actually reviewed these YouTubes and these Rumbles and these tweets to tell me that these things are false, misleading, or just wrong. It just, who's driving the ship up at the ABFM? And I put people who got the shot, they're more likely to get severe COVID. We know that the shot actually doesn't prevent anything. And in some cases, it reduces immunity system at the T cell level and the humoral level, and actually causes worse scenarios. This is more stuff about all-cause mortality, just saying that in the Pfizer data, yeah, fewer people got COVID, but more people got sick, actually, of all things, in the placebo arm. And then I cite the VAERS system and gave some numbers, and they can't. And actually, I'm actually low. It looks like when I said that we're sacrificing 150,000 people to help 10,000, that ratio, I'm not even sure that I think that's actually giving the shot more credit. I think we're actually, the ratio of deaths to help is actually much higher than that. And there's people more learned than I am at looking at the drill down data that can do that. Also, I got cited for saying stop the shots. Now, that's denigration. I don't know. But that's what they cite. And they say that's misinformation, disinformation. It's an opinion, fools. I said, I went over Paxlovid, Novavax, and boosters. And Three Musketeers. And then I talked about treatment with hydroxychloroquine, ivermectin, and other things. I wish I could tell you all the people, all the physicians I met at a recent who were just doing great with treating this stuff early, not just with hydroxychloroquine and ivermectin, but relying on these things, boosters and Paxlovid. It's ridiculous. And again, I put the shots are not proven safe, and we've known that they're not effective. I said that. I'm sorry, but that's already been proven. And it wasn't really speculation at the time of the video from August of 22. Again, I'm kind of disappointed that they didn't, maybe because all my videos are kind of I archived them. They didn't have 2021 videos to criticize me on, or 2020 videos. That would have been even better. I put vaccines have no public health benefit. We know it causes more injury than it causes benefit. I'm telling my patients not to get any COVID, and that still holds. I'm still telling my patients do not get the COVID shot. But for somehow or another, that's denigration. That's the ABFM telling me that my advice to my patients they disagree with. Well, the ABFM is not licensed to practice medicine, nor does their reputation support the fact that they know anything about medicine. This is old data. Theirs has 1.3 million adverse events, and I guess they consider that denigration because it's not false or misleading. I put, after careful consideration, if you hear about them giving the bivalent COVID shot, run away as fast as you can. Again, that's medical opinion. I do not advice to my patients, and this is all advice to my patients. I do not want my patients to be getting an experimental shot repeatedly. It just makes no sense. I'm not going to go over it. This is another stop the shot, a reminder video, because I guess the first stop the shot video wasn't good enough. So I talked about VAERS data. I talked about mRNA technology. Then I get into this. This whole paragraph is an analogy. It's not really stating any particular detail. It's just using an analogy about how a person assesses risks and calculates. But I guess they decided to quote the whole thing because they didn't know how to read it. And I guess the last part here is shots don't work. They thought that was a really bad idea to put that out in the public. Anyway, I put Pfizer lied, people died. Is that in dispute? I don't think so. And I put doctors, politicians, public health officials are mostly responsible. So that's the truth. Now, we know there was the government and the commercial stuff, but I still feel that the physician should have stood up and said, this is ridiculous. We can't be doing this to our patients, for crying out loud. So I put in here, the regulatory agencies are swamped with pharmaceutical dollars. There's no independence. again, the FDA gets 70% of their revenue from pharmaceutical companies. How is that debatable? How is that denigration? And I put health agencies are corrupt and financially motivated. Okay. And so anyway, and I put vaccine manufacturers can kill and maim and have no responsibility. They don't. There actually is a law from the 80s that a vaccine manufacturer is immune from any damages. Anyway, those are the specific things that they listed that I guess they would consider citations as far as denigration, false, misleading, non-factual, etc. I'm not sure what the terms were, but I could debate that none of that is. And so what I did was I said, okay, I'm not answering any of your questions to cite these things I state, but I told the ABFM in a response letter that instead you need to write back to me, and each of these things you cite, you need to prove to me how they are provably incorrect, and I'll respond to that. Now, back to the ABFM, though there was also some bullet points they wanted me to answer, and this is the one I like the best. They wanted me to provide a description of efforts to review or correct information provided to patients. Now, I know what this is. This is saying, Carl, tell us how you're going to acquiesce and mea culpa. My response is that it is totally my responsibility when I see misinformation, disinformation put out by the CDC, FDA, and World Health Organization. It's totally my responsibility to communicate with patients why I think that is bad, and they should not be taking FDA, CDC, or World Health, or ABFM advice as sound medical advice. That is my job and responsibility. Maybe we say that's not really what a physician's job is, but in this day and age, it sort of is. Anyhow, so that's the scoop on this. Now, so as far as practicing medicine, how does this affect my ability to practice medicine? It doesn't. I'm licensed by my board of medical examiners in Louisiana. That's all that matters. Whether I lose certification in the ABFM does not matter for me. I do not belong to any insurance company, and I also do not on staff at any hospital. So I don't have to provide certification per se, but just know that I do on my own, regardless of the ABFM, do continuing education throughout the entire course of the year. Patient care is a privilege, and we take that responsibility totally seriously, which is why I was vocal in beginning March of 2020 about what I saw as the response to this pandemic. So my practice is not in jeopardy. As a matter of fact, I've already been certified by another board, the National Board of Physicians and Surgeons. So even if the ABFM withdraws my certification, there will be there will be a response. But even if they do withdraw that certification, it's meaningless. And as a matter of fact, as so woke as the ABFM has become, I really am not wanting to be a part of it because it's now kind of a greasy organization. I'm not quitting them because I want to stay in this game till the end. So we'll see how this goes. Anyway, so that's just a summary of my letter of concern, which occurred back in early September of 2023. I responded to it. I never have gotten a reply, and it's been a couple months. So we'll see how that goes. I'll keep you updated if anything interested. But anyhow, so y'all take care, and I enjoyed presenting this to you, and we'll be back in the near future, hopefully. All right. Thank y'all. Bye.